friends. Today we are going to discuss about World Health Day 2025. This year theme is Healthy Beginnings, Hopeful Futures. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about World Health Day 2025. This is celebrated every year on 7th of April by World Health Organization. This is the same day WHO was formed. Hence, this day has been earmarked to celebrate World Health Day by drawing attention on public health issues. So, my dear friends, this year, WHO has come up with an important theme which draws attention towards public health issue, that is maternal health and child health. The main reason being is, in this contemporary world, conflicts, war, disaster, terrorism, environmental health causes devastating lives, causing death, pain, hunger, and psychological distress across the globe. In this scenario, the weakest are affected most, that is women, children, geriatric population, and the person with disability. So, my dear friends, this year, 2025, the WHO has given a clear mandate with regard to focus on mother and child health. That is, the theme is healthy beginnings and hopeful futures. This theme has been taken most probably from the Healthy Beginnings and Healthy Futures is from American Bar Association. They brought a book, a manual for judges in 2009. Actually, you can download this. This is also on maternal health and child in conflict with law or in a child custody case. So this theme is taken from there. So healthy beginnings and hopeful futures. This is an urge by the WHO to everyone, including government, policymakers, healthcare providers, to focus on maternal health and child health. Basically, to prevent maternal and newborn deaths so that we can prioritize women's long-term health and well-being, helping every woman and baby to survive and thrive. Here, maternal health refers to the health of a woman during pregnancy, childbirth, and postnatal period. Let's focus on maternal health, and the yardstick usually every country is measured by maternal mortality rate. Let's look into this. If you look at the global maternal mortality rate, the recent estimate shows that every year 3 lakh women die during pregnancy or childbirth. Over 2 million babies die in the first month of their life, and around 2 million die stillborn. That means roughly one preventable death every 7 seconds, my dear friend, across the globe. So this is a serious public health concern. Hence, WHO has focused on this important theme on maternal health and child. So what is maternal mortality? Maternal mortality is defined as the death of a woman during pregnancy or within 42 days of termination of pregnancy. And the death should be directly related to the or aggravated by pregnancy or its management. The other causes should be excluded. If you look at the Indian data, maternal mortality is slowly declining. From 103 per 1 lakh live births in 2017 to 2019, now it is 97 per 1 lakh live births in 2018 to 2020. This translates approximately 24,000 maternal deaths every year, my dear friends. So if you look at this picture or the map, you can see the highest maternal mortality rate is seen in Assam and the lowest is in Kerala. Actually, the Kerala maternal mortality rate is less than American maternal mortality rate. That means in India, we have excellent healthcare in certain parts of India, and in certain parts of our other states, maybe north and northeastern states, the numbers are very difficult to digest. You can see the heat map. It also clearly indicates towards the north and northeastern states. 93% of the pregnant women had at least one ANC visit in 2021. That means before the child is delivered, 93% had one doctor visit. 60% had four or more doctor's visit, that is antenatal care visit. The proportion of women not receiving any ANC visit dropped from 38% in 1993 to 6% in 2021. That means majority of the childbirths are occurring in the institution. So this is again, you can see the graph which shows more than 4 ANC visit is increasing, less than 4 ANC visit is decreasing, further is 0 ANC visit. That means antenatal care is increasing day by day. Now let's understand what are the factors which contribute to the maternal mortality rate. Poverty, illiteracy, lack of awareness about the health, poor maternal nutrition, anemia in mother, early or teen pregnancy, postpartum complications, lack of intensive care units or beds, inadequate antenatal visits, poor coverage of antenatal care, that is access to health care, and suboptimal health facilities and staff. So these are the factors which have been identified. 9 in 10 pregnant women in India are availing institutional deliveries. That means 90% the childbirth are occurring in the hospital. 8 in 10 women have the ability to make decision about their health. That means 80% of them, maternals, are able to make decision for themselves. Further, medical termination of pregnancy, which was amended in 2021, has given a comprehensive reproductive rights to the pregnant women. Not only that, even the Supreme Court has interpreted MTP Act in favor of women. So, my dear friends, in this comprehensive legislation, rights and policies are in favor of decreasing maternal mortality rate. The recent study, which was published in 2021 in an international journal, the leading cause of maternal death in India, the most common was obstetric hemorrhage, that is 47%. Pregnancy-related infection is 12%. Hypertensive disorder of pregnancy is 7%. Unsafe MTP and obstructed labor remaining. So here we need to focus on the hemorrhage. That means the 50% of the deaths are occurring because of the bleed. Either they are reporting to the hospital late, the complications are not seen, or else we do not have equipped hospitals to deal with complicated pregnancies. However, you need to understand these 3 delays in India which is causing maternal death. Delay in making the decision to seek care. That is because of illiteracy or non-availability of healthcare. Delay in getting to a health facility. That means they report to the hospital very late. Already the mother is gasping. In such a scenario, the doctor finds it very difficult to deal with complicated pregnancy. Delay in health institutions providing proper care. Along with these 3 delays are the major factor for maternal mortality in India. And hence, our guiding framework for policy programs revolves around these 3 delays to be decreased. Most maternal deaths are preventable by timely management, skilled human resources for health, and supportive environment. And hence, as WHO has said, Government of India is also fighting to decrease and stop maternal mortality rate, because every pregnancy and every birth is unique, and this needs to be respected, and we make efforts to stop maternal mortality in India. Now let's move into the infant mortality rate. It is number of infants' death within 1 year of age for 1,000 live births within specific year. Here in India, in 2024, we found that 25.7 deaths per 1,000 live births. This is the numbers in India. That means for every 1,000 children are born, 26 deaths are occurring. If you look at the reasons, it can be prenatal care or poor postnatal care. Prenatal care is medical care during pregnancy is either poor, or postnatal care, that is fourth trimester, it is also called as, that's 3 months after the childbirth. Here, one need to focus on mother's physical health, mental health, and social well-being. So that needs to be taken care so that overall health can be improved. If you look at the causes of infant mortality rate, it is not only health factors, but also socioeconomic factors have been connected. First and the foremost is inadequate prenatal care and postnatal care, malnutrition, infection and diseases, birth complications, poor sanitation and hygiene, low birth weight, lack of access to emergency care. In this regard, the Government of India has implemented several initiatives to address infant mortality and maternal mortality also. The National Health Mission focuses on improving maternal and child health services. The first program which needs to be discussed is Janani Suraksha Yojana, financial assistance to promote institutional deliveries. Further, ICDS, that is Integrated Child Development Services schemes, aims to improve the nutrition of the children and also the mother. Janani Shishu Suraksha Karyakram, a free prenatal, postnatal, free transport, diagnostic, medicines and other consumables, diets and blood in public health institutions so that the pregnant mother and the family are not financially deprived. Surakshit Matritva Ashwasan, that is zero cost and zero tolerance for denial of services for every woman and newborn visiting public health facilities. This is an amazing policy which they talk about zero cost, zero tolerance for denying the healthcare facility for both baby and the pregnant woman. Pradhana Mantri Surakshit Matritva Abhiyan provides pregnant women a fixed day, free of cost assured, quality antenatal care on the 9th day of every month, and Asha workers visit to home. This is more than 4 visits, it can be there. So that means a proactive step has been taken by the government to do home visit. Further, there is a Lakshya, aims to improve the quality of care in labor room and also maternity operation theaters so that the infection decreases, availability of OT, availability of quality labor room is being focused. Comprehensive abortion care services. This will help young women who are teenage pregnancy is becoming more so that maternal death does not occur because of abortion. Delivery points, that is, terms of infrastructure, equipment, and trained manpower availability in community health center has been focused. Operationalizing obstetric ICU is being a focus in all community health centers and district hospitals. Capacity building for MBBS with regard to giving local anesthesia, general anesthesia, obstetric care with regard to C-section, especially in the remote part of the country, is being the focus now, especially northeastern states and northern states. Maternal death surveillance review. Whenever there is a maternal death occurs at the district level and at the community health centers level, there is a review done and what measures to be taken will be discussed. Reproductive and child health portal has been formed. That means this is an innovation which is with regard to Digital India mission. In this regard, a antenatal care when it starts, the digital entry is made, monitoring of the pregnant woman, childbirth, monitoring of the child's growth, and also immunization is taken care. MCP card and safe motherhood booklet is given. Pradhan Mantri Matru Vandana Yojana has been focused. A maternity benefit program. This is by the Ministry of Women and Child Development. The maternity benefit is available to a woman for the first living child. Further, this PMMVY 2.0 has been upgraded. That is Mission Shakti. If the second child is a female, To encourage the parents to have this child, additional cash incentives will be given to the parents. Mother's absolute affection, early initiation, and exclusive breastfeeding for next 6 months has been the focus so that the child infant mortality rate can be brought down. Universal immunization program has been focusing to provide vaccination to children against tuberculosis, diphtheria, pertussis, polio, tetanus, hepatitis, measles, rubella, pneumonia, and meningitis caused by Haemophilus influenza. So these are the very important programs which the government of India is running. Further, Rashtriya Bal Swasthya Karikram, children from 0 to 18 of age are screened for 32 health conditions to improve the child survival. Anemia Mukt Bharat strategy has been in place. Encouraging the kangaroo mother care has been one of the important initiatives of the government of India. Here, it involves skin-to-skin contact between the mother and child, that is the newborn, and it is recommended especially preterm and low birth weight babies. So these kinds of care within the home decreases infant mortality rate. To conclude, my dear friends, World Health Organization has called for an action to prioritize the services for maternal health and child so that the maternal well-being is taken care, so the child is also taken care. The government and healthcare communities must take urgent action to end preventable maternal and child death. Ensuring survival is not enough. Women must also access to quality care and allow them to live healthy, fulfilling lives beyond childbirth. That is the motto of World Health Organization, and the government of India has also taken certain steps towards this. In this regard, the government of India is calling for listening to women, what is her choice and rights, and supporting the families. And also, the World Health has estimated an investment is not a cost. That is, return on investment, every $1 spent on maternal and newborn, estimated yield over a period of time is $15 in return. So cost on investment, cost on return is also very high, 1:15. So my dear friends, the policy makers also need to think about investing in maternal and child health, and we have to focus on decreasing maternal and child mortality in this year. And this is the motto of World Health Organization: healthy beginnings, hopeful futures. Thank you for giving your valuable time. Stay safe.